All right, John. I wanted to ask. So I know that we're looking at the potential reintroduction of face-to-face learning if things hold steady with the COVID situation. But I was trying to look ahead to next school year, right? So they're basically saying that. Well, we had Annette on. She was saying by summer they would hope to have enough people take the vaccine. So, are we looking at next school year and what learning options would be available, or is that too far ahead?
Yeah, right now that's a little too far ahead because we're still wanting to learn more about the vaccination, the strategy for the rollout, and to see all of that take place. So it'll probably take maybe several more weeks of learning before we can figure out exactly how that'll impact our planning for next year. I mean, next year, obviously, we're hoping that we will still have the ability at a minimum to do the three models of learning, if not more face to face, because we believe that face to face instruction is necessary to carry on our mission for students. But again, there's just so much that we all, I think, all together are still learning about the vaccination and how that's going to go and how that's going to roll out. We're very excited. I saw the news from Great Britain and the first COVID-19 vaccination. I mean, just kind of exciting to see light at the end of the tunnel. But we're still months away from getting to through that tunnel. So of course, we'll keep everybody abreast of any planning that far ahead. I think between now and then is probably the tricky part because we're not out of the woods yet, but we still want to see what we can do to expand or to reopen schools if that's possible.
Have you completed the survey or with your staff on who would take the vaccine and who wouldn't? Do you have any kind of preliminary findings?
No, right now we're trying to gather that information by the end of this week. So we just met. It was funny. We met on Friday evening, basically, and then we put, of course, when we hear something like that, we put the word out right away to all of our schools. And then by Monday morning, or actually by the weekend, we were getting questions. What's going on over at the DOE and this vaccination? I said, well, it just came out of our meeting, so I'm sure the word didn't get around. But essentially, we did two things. I mean, there's two things. One is that we already provided a whole staffing pattern list, listing of our employees by category to public health, because they had already done an initial survey of all government employees, just to help, I guess to help align the strategy for trying to address frontliners and so forth as part of that effort. But in our last discussion on Friday, knowing that not every employee was necessarily going to go back face to face, and knowing that we're going to have employees who are in the high risk categories, the Lieutenant Governor asked if we could, for even further refine, that approach, so that if we were able to reopen face to face, those who are definitely going to be at the school sites, could be prioritized as part of, ensuring that they are safe and feel safe when they return to school. So it was just another slice of that data in terms of confirming, if we do reopen, which among all of your employees are actually going to be at the school site interacting with kids and so forth. So we hope to get that in by Friday. We're still collecting that data.
When will you be making the final decision on face to face?
Well, I think we had initially targeted December 15th, but just Monday, after further discussion, we're probably going to set up a special meeting on December 22nd to make a final determination. And that's for two reasons. One is that we want to allow the governor an opportunity to see more data relative to this lower CAR score and whether it's going to maintain at that level and so forth, because I think it's going to be important that she be at a comfort level and maybe make some initial determinations as to whether she feels that opening is going to be a good idea or not. And then second, we are actually in the process of updating the registrations for all the parents regarding the model of learning, and that's not going to be fully completed until the 18th. So we thought that obviously we'll give an update to the board at their meeting on the 15th, but we might want to wait for a little bit further for the governor to have further opportunity to assess the community health score, and then for us to have much more concrete numbers on the actual number of students who actually are willing to come back. And then when the board makes the determination along with the management team, we can have those real numbers in front of us for planning purposes.
So based on the stakeholders meetings that you had a couple of weeks ago, what was the general, consensus from these stakeholders on were they more inclined to go back to face or stick with the other models of learning?
Yeah, if I had to take their temperature a few weeks ago, it would be more that I would expect less, parents wanting their students to go face to face, just because of all the uncertainty and because of the surge in the numbers over the last few months that forced us to lock down and prohibit face to face all semester. So back in July when we did that first registration, things looked great. The numbers were really low, and we saw about 40% of our families were willing to come back. We don't expect as high a number this time because basically it's only been the last week or so where we've seen the numbers kind of come down into that level where we were earlier in the summer, and we'll have to see if we can sustain that effort. But I think the general sentiment among parents is that obviously it's a balancing act, but I think there's a lot more anxiety than there was back in July. So I would guess that the numbers will come in lower than they were, but we'll see when the 18th comes around. And again, for the parents, it's the message to them is because we see this, on social media when an update comes out about GDOE, because when it goes on social media, then it gets forwarded to us. And is this true? Is it not true?
Yeah.
And the some of the sentiment you hear on social media is when they see the article. If they don't read it close enough to know that parents have the option, it's like, no, I'm never ever gonna, you're not gonna make me bring my child back to school and, something, things like that. And we say, well, that's exactly the point. We're not forcing anybody to come back for face-to-face instruction at this point. We are gonna give an option to the parents so that those who feel safe, can come, and those who don't, still have the option to stay at home, do it online or hard copy. So that's really critical because I don't want that word to get around that all of a sudden everyone's going to be forced to be back in school. It really isn't that type of situation where it's safe enough to do any of that. And I think we all know that. So we do want to make sure that the right information goes around. And again, by the 18th, we'll have those more confirmed numbers. But I expect it won't be as high as it was in July.
So you're not concerned what might happen on Christmas if people start gathering and not practicing social distancing?
That's always a concern. I think that's where the governor comes in to make some of those determinations. And we really sat down with Dr. Cabrera and talked about the CAR score and tried to understand better how that aligned with our assessment. And to be honest, they're using similar data. The data is out there. They're using positivity rates. They're using the number of cases, and then they're using a factor which looks at the momentum of spread. And actually, that's just looking back 2 weeks and determining whether last week was any worse or better than the week before. And I think the problem is just a matter of explaining that, to your lay person on the street and trying to figure out translate the number. So that was one of the challenges, but it does align in the sense that, we capture the same data. I think because we look at a 14-day window versus a 7-day window, our assessment is going to tend to lag the governor's assessment, which means, we're taking a little bit more of a conservative approach. We're not going to base ourselves off of what happened last week. We're actually looking at the last 2 weeks to see what kind of trends we're seeing. I think the interesting part will be to see if we can maintain where we are today, because we did come through Thanksgiving, and that was one of the big fears about Thanksgiving, resulting in another wave. And of course, Christmas, the extent to which there's any reopening, that's going to be on our minds. What we're trying to do, though, when we reopen is we're not going to say, it's not a red and green light type of thing. Either we're closed or we're open. We want to look at ways to do that gradually so that we're at levels of students on campus that are manageable, that are safe, and that we don't overdo it, in terms of trying to be too ambitious, bringing, students back to campus. So I think we're going to look at, instead of bringing, everybody back to campus at once who wants to be there, looking at doing it. Of course, we're going to do alternate schedules, but also looking at, whether we want to do this with certain grade levels first before we expand it to, all of elementary, all of secondary. And that's what we're working through those scenarios. That'll give us a chance to reopen without, going so fast that we can't, put the brakes on when we need to. I don't want to be in a situation where we're opening and closing and opening and closing like we've seen in other school districts. So I'd rather take a slower approach, give us a chance to reopen. Let's start with a smaller group, then we can build that group up, and then we can, and as we reintroduce different levels, the teachers and staff will all be, continuing to practice and reinforce those safety protocols. I think that's how we want to see it roll out over that first month or two. Mm-hmm. So that's, again, that's just the planning. We're nailing down on some of those details so that we'll be ready for any scenario.
By any chance, is GDOE possibly going to get any of those Binex Now rapid antigen tests?
I know there's a lot of discussion happening around that. I'm no expert, but I've heard the discussion about first of all the pros of the availability and the affordability of those tests, and then I've heard some questions about the accuracy and the efficacy of those tests for our situation. And so we're listening, we're hearing the information, we want to rely on our public health professionals, but we also are asking the hard questions of them as well. So, every time they do their JIC report, we look at the molecular versus the antigen tests, and we try to make sure we keep an eye on how the positivity rates are aligned or not aligned for those two different types of tests, so we can get a sense of, whether there are if there's anything out of the ordinary. We want to make sure we understand what that is. And, for the first couple of weeks, I think we were, I was okay, but the last few days, I noticed that the molecular tests show a higher positivity rate than the antigen tests. And if they're using more of the, those BinX tests, and that contributes to it, I need to know, whether that's something we have to pay attention to and work around, because that's something that, so I'm not an expert in it, but it's something that would worry me. It would be affecting the risk assessment that we're doing. So that's an active conversation. And a year ago, who knew we would have these kinds of conversations? But this is where we are. We're talking about everyone doing their research and making sure you're ready to to answer questions and try to provide the right information.
Mm-hmm. Where are you with that risk assessment?
Right now, it's again we're lagging, and this is we're lagging the CAR score. So we do see an improvement in the positivity rate. I think our 2-week positivity rate as of yesterday was around 4%. So that puts us in a lower risk situation when it comes to positivity. But the other indicator, which is the number of cases we're seeing on a total, total cases over a 2-week period, we're still at the highest level. So, these factors are affected by a lot of things, including the volume of testing that's happening as well. But we do think that the number of cases is also coming down. It's just not coming down as quickly. And so we do anticipate, if the trends hold, that number will come down and will probably hit, a moderate risk level within a week or so. So the risk is lowering, but it's just very important that we understand all the factors that are contributing to it. I mean, it's a good thing, but it's one of those things where you have to have a healthy dose of skepticism to make sure we're keeping everybody accountable and responsive to all the community fears and anxieties that are out there. So I encourage people to question and ask the hard questions, because we need to do that for our families as well. Mm-hmm. So I do want to thank Dr. Cabrera, because he was very good, and I know we saw some of that news where I might have been questioning their approach, but he was very good in explaining exactly how we got to where we got to, and it's just important that we were able to explain it to everybody. So I think when we have that assessment, we have to be able to communicate that, and I think that was where some of the feedback was coming from. Nobody really knew, what the CAR score meant or what our risk assessment meant, and we really have to spend a lot of time explaining, that to our constituents.
Right.
I just had one more question, and it was just a follow up question to what we asked the Lieutenant Governor about regarding this subsidy as part of this expanding
Right.
access. Can you explain that a little bit more in detail?
Well, basically, we're targeting just like many other school districts are targeting. We're targeting those families who do not have access to the internet, and a lot of the basis for that challenge aligns heavily with affordability of internet service and parent and families who are able to afford that. So we are looking at prioritizing those who are already a part of some of our public assistance programs as a first level of priority, and then be able to expand beyond that. But the notion is that if you qualify, we will cover the costs of your internet service for the determined period of time, that when we finalize everything for that period of time, we will pay the full service for you. And then, of course, the private schools and charter schools do not have to necessarily use that same criteria, but that's how we're going to do it. So if you do, qualify, again, that's something like, I don't have the exact details, but it's along the lines of if you're a free and reduced lunch, if you're a participant already in a SNAP program, you're going to be qualified and you have to apply for it to demonstrate that you need it. And then you'll be able to take advantage of it. And like I said before, I mean, there are some obviously debate about how to provide it, but these devices are for educational purposes. They're for internet access. You can't get on Netflix, you can't get on Facebook or the other. There are certain limitations to what you can do with these devices. So, we did it so that we don't just have abuse of the program by those who just wanted internet access, but are not necessarily going to use it for the right purposes. So we took a lot of those measures, and when we roll that out, again, if you qualify, we are going to cover those costs. We did consider, ways to do a partial, to set up different tiers and partial costs. We'll pay part, you pay part of it, but at some point it gets too complicated to run a very efficient program. So we made that determination, and then so the subsidy means that if you do qualify, DOE will cover the cost of that service once you meet that eligibility requirement, and it won't be forever. So we're going to have to think about longer term, strategies for continued online access. Should we need that in the future?
Okay. So you're gonna tap Gore to take advantage of some of their community block grants?
I don't know. I mean, that's a continued discussion that we have to have. Right now, we do have the significant amount of funds from the federal government that we need to deploy, and there's a lot of accountability already associated with that. So we know that there are those block grants out there, and depending on the administration and the approach, the priorities will change. But with regard to schools, our biggest target right now is looking at the potential stimulus package to see if additional funding for education will come through. And that's something I know that the Senate and the House are discussing, this month to try to see if they can get that done as well. That would help provide additional resources to ensure that we have sufficient amount to work through this COVID-19 period until we get back to some level of normal.
All right, John. Anything else before we move on to our next guest?
No, I thank you. I mean, sometimes we don't have significant updates from the prior week, but I do think it's important to just keep reiterating, what we are doing for the public, because as you know, not everybody hears it and hears it at the same time. Mm-hmm. But again, if I could re-emphasize it, is that we are only going to reopen if it's safe to reopen. We're going to reopen in ways that we limit, the attendance on campus at any one time, and parents are going to have a choice in this matter. So we don't want anyone to think that anyone's going to be forced to go back to school, one way or the other next semester. We'll still offer parents a choice, and we're just really looking at ways to safely return to face-to-face, especially for the students who need that. And that's really our effort and priority.
All right. Thanks, John.
Thank you, John. Appreciate
Right.
your time. We had a comment here from Anita. Mr. Fernandez is doing his job, and he's always letting us know what's going on. To which Glenn Lujan commented, yes, he's always providing good information. So we love these little updates, John.
Appreciate it. Thank you.
Okay.
Thanks for
Okay,
that.
be safe.
Take care.
It's 8:59, 9 o'clock. We're KUAM FM and Agotnia, Guam. We'll be back with more of The Link on the Breeze, which is brought to you by Cabo Select Care, federal employees and annuitants. It's 2020 open enrollment. Enroll now until December 4th.